Good morning or good afternoon, everybody. My name is Sean Johnson, and today we are presenting on navigating uniform guidance updates, thresholds, timelines, and compliance best practices. Want to thank the team at Community Link Consulting for sponsoring this and for having Dan and myself as presenters for this topic. Want to thank each and every one of you for joining us. Couple just housekeeping things before we start. We did upload the handouts to the GoToWebinar, so you should be able to download those. If you have any questions, please feel free to ask those through the Q&A or the chat function through GoToWebinar, and then either Dan or I'll be monitoring those while each of us are not speaking, while the other one is speaking. We'll also pause a couple times throughout the presentation and answer questions throughout. So about us, Dan, can you advance that slide? Perfect. So Dan and I are both with DZA. We are a CPA firm, locally owned firm in Spokane, Washington. The firm started in 2003. So we've been in business 21 and a half years, almost to 22 years. Our primary clients that we serve are community health centers, critical access hospitals, other entities within the healthcare industry, also a few social service not-for-profit organizations. We have clients in over 20 states throughout the United States, and we have employees in over 10 states. So we're spread out quite a ways. Our main service lines are financial statements, single audit, tax being 990s for our not-for-profit clients, client accounting advisory services, and then also Medicare and Medicaid related services. A little bit about Dan and I. I'm one of the partners or owners here at DZA. I've been with DZA since 2004. I've been in public accounting since 2000, so almost 25 years. And I've been working with community health centers, critical access hospitals for 25 years, mostly on the audit side, but a little bit on the reimbursement side over the years as well. And I'm also the audit partner for the majority of our community health center clients that we have here at DZA. We also have Dan Cleveland. Dan is a senior manager with our firm. He's been with us since 2021. But prior to that, he was with another CPA firm for 8 years. So he's at about 11, almost 12 years experience as a CPA. Specializes in working with community health centers, other not-for-profit organizations. He does a lot of our single audits. He works a lot with me on our community health center clients. And he also has experience with SEC registered publicly traded companies at his previous firm, and then also not-for-profit organizations. So overview of our presentation, some things we'd like you to be able to take away at the end of the presentation is to understand the changes for the new uniform guidance and the different audit thresholds that we now will operate under when they take effect, and how that will impact your organization, whether or not you need a single audit still when you did before. There's a few organizations that may not. Also, the major programs will change, potentially the thresholds on those will change. So there might be some circumstances where a program may not be selected as a major program when it once was. Not as many organizations will need single audits as they did in the past. We want you to understand the applicable dates. So when the uniform guidance revisions are applicable to both your awards and the audit. So depending on when awards are issued, when you get those NOAs, will depend on when you have to apply the new uniform guidance versus the previous guidance we had. And then we'll also give you some best practices to assist in monitoring the compliance requirements applicable to your awards to make it a little bit easier for you and the auditor when auditing those awards. I have a little bit of a disclaimer, just letting you all know that our presentation is not authoritative guidance. It is our interpretation based on our reading of the updated uniform guidance the guidance that Council of Federal Financial Assistance has issued, and various other trainings that Dan and I have attended. If in doubt, the appropriate method would be to contact your federal agency for official guidance. Talking to your auditors is absolutely fine, but we are not the source of the authoritative guidance. The other piece of the disclaimer here is that this presentation is just intended to be a portion of the changes to the uniform guidance. It's not all inclusive of the changes in uniform guidance. Although we did include some additional references at the end of the presentation as well. And then we tried to streamline this presentation mostly to FQHC or community health center entities. This would also be applicable to, I know we have a few of our critical access hospital clients in the presentation as well, and this would generally be applicable to you as well. So as accountants, we all love our acronyms, so we tried to do our best in defining them for you. So if we say an acronym, or you'll see it we have a lot of acronyms in the slide, we tried to give you a slide that will give you the definition of those, so you can use that as a resource throughout the presentation. And then we wanted to just give you an objective as to why the uniform guidance was changed. The final version of the uniform guidance was released in April of the past year, 2024. It is applicable or effective for October 1, 2024. Dan will go into a little bit more details on the dates later in the presentation. But the purpose of the changes to the uniform guidance was to incorporate statutory requirements and administrative priorities for the federal agencies. So made some changes there. One of the most important objectives was to reduce federal agency and recipient burden. So the reason why the thresholds have changed is to allow for some organizations to not have to have single audits when they did before, without reducing the overall quality of the single audit process. Also to clarify sections that recipients or agencies have interpreted in different ways. So there's a lot of just clarifications put into the new uniform guidance that helps us as auditors and helps you as auditees. And then kind of related to that is to rewrite some of the sections into plain English language, improving the flow and addressing inconsistent use of terms. And at that point, I'm going to transition the presentation over to Dan. We'll go back and forth a couple times during this presentation. So Dan, go ahead and take it away.
All right, thank you, Sean. So just a little high-level overview of the general updates in subparts A through D of the uniform guidance. They've added and revised several of the definitions within there for a lot of the terms, and we'll go over some of the more important stuff later. They've added a section on whistleblower protections for people who reported non-compliances and stuff to federal agencies. They've clarified that internal controls must be documented. This has always been the policy, but there's some clarifications, and we'll discuss that one in detail a little more later, because that one is pretty important and applicable to almost everybody we deal with. There's a requirement that, and this is kind of a new one, but something most auditees have already been doing, is they have to have reasonable assurance over cybersecurities and stuff to protect personally identifiable information. This is, again, been part of the requirements, but not explicitly stated before, and now it is. They changed the threshold for the value of equipment that you can dispose of without other responsibilities from $5,000 to $10,000, similar with unused supplies. And then another thing that they clarified again, and this has always been the case, but they clarified it and stated it more explicitly, is that the pass-through entities, if you pass through funds, you must accept all federally negotiated indirect cost rates. So if you're an organization that has a negotiated cost rate with HRSA or any other federal agency, and a subrecipient pass-through entity is telling you can't use that, they did clarify that they must accept that indirect cost rate that you've already got approved by a federal agency. All right, my slides, there we go. So one of the key definitions that's going to be important that was updated was the definition of equipment. The new definition actually states now that $10,000 can be the minimum for your capitalization and identification of federal equipment or equipment purchased with federal awards. However, they did clarify also that you still need to, it is limited by your capitalization threshold for your organization, meaning if your capitalization threshold is still $5,000 or lower than the $10,000 of for the new threshold, then that your internal capitalization threshold does become that same threshold for identifying the equipment as federal. And this is something that I really want to be clear here is before you go saying, oh yeah, I can change my capitalization threshold to $10,000 and relieve my burden on some of these assets we're purchasing, you do need to make sure that that would be in compliance with any other contracts or agreements for non-federal awards or other items that would limit and require additional reporting for that below that $10,000 threshold for assets purchased. Sorry, I kind of jumbled that one. But, all right. They also redefined or clarified the definition of question costs, and this was important because a lot of auditees didn't understand what it meant when they received a question cost in their audited financial statements. And basically, a question cost, they clarified, is something that the auditor says, in their judgment may not be compliant or did not have documentation or was unreasonable based on their understanding of the award to be purchased with federal funds. And they clarified and again emphasized that question costs does not automatically mean it was an improper payment. It just means that the auditor, in their judgment, does not know for sure that it is compliant. And that's important because, again, if you get a question cost, it doesn't automatically mean HRSA is going to come back and say you owe the money back or you're not compliant. It just means that the auditor has identified it and they can't support the compliance. Internal controls. This one, again, this update clarifies that internal controls must be documented. This has always been the case for grantees, that they have internal controls, but it was always assumed that they'd be documented. And now this specifically puts it into the Code of Federal Regulations that you have to document it. Now, similar to before, there's no prescribed level of documentation you need over your internal controls. However, you do have to have some documentation. So if you have somebody who is reviewing and approving stuff, they need to be documenting that they're reviewing and approving stuff. This goes back to our old auditor phrase, if you didn't document it, you didn't do it. And so if you don't have evidence that your control is in place and working, then it is not considered in place and working. Just a quick note on that also, there are areas of uniform guidance that do require specific policies and procedures to be documented, specifically cash management. There's requirements to document how you're maintain compliance with cost principles, and then there's also specific policies and procedures required around your procurement and your methods of procurement. They did make some updates to the procurement standards also. They changed the definition or the verbiage from small purchases to simplified acquisitions because that's more standardized terminology. They also clarified that micro purchases and simplified acquisitions are types of procurements for small purchases. They're not separate categories, they're informal methods. They also clarified that, excuse me, the simplified acquisitions, for the simplified acquisition threshold, you have some judgment in determining the number of competitive bids you get for your purchases. Competitive bids have always been a requirement, but until you get to that threshold, you don't have to have the formal, go through the I think the threshold right now is $250,000. Again, it changes periodically, so I'm not 100% sure on that piece, but between that $10,000 and $250,000 micro purchase threshold to the competitive bid ones, you get to choose your method or your number of competitive bids you receive. That being said, there are specific requirements if you're going to do a non-competitive procurement. So it does kind of still imply that you need to have more than one bid for those purchases above the micro purchase threshold. Those non-competitive procurement standards are still very specific to certain situations, like only available from a single source, only for public emergency, won't permit your delay, or if you have a prior approval to do a non-competitive sourcing. Otherwise, again, if it doesn't meet one of those standards that are specifically defined in Part C of this standard, then you must go through a competitive bid process. And again, regardless of whether your small purchase threshold or purchase policy requires one or two or three bids or however many bids, you still need to make sure you're going through the process of documenting that you did follow your own procurement policy. I do advise that you go and make sure your policy is up to date with the updated standards in here. If you haven't reviewed your procurement policy in a while, it's probably time. And again, make sure you're following your current policy as well, because your current policy, as long as it's in compliance with the procurement methods in uniform guidance, is actually what you should be following, and you can get a finding for not following your own policy too. Another note, if you do decide that a purchase or procurement qualifies for non-competitive procurement, make sure you document why it qualifies and how you determine that it qualified. For example, if it's only available from a single source, make sure you document that you verified, you called around and you couldn't find anybody else who could provide the services. Or if there's a public emergency, obviously get the notice of public emergency or whatever. So it clarifies again that for pass-through entities, or if you receive pass-through funds, really the only party who should be determining whether you are a subrecipient or a contractor is the pass-through entity. That entity, as a pass-through organization, should be providing all subrecipients with the CFDA number, all of the required information to know that these are federal pass-through funds, so that you as a subrecipient can maintain your compliance in there. And again, really the only organization that should be making that determination is the pass-through entity. It also clarified that just even though the uniform guidance says here's the here's the definition of what a pass-through entity would be versus a contractor, those are not clear-cut lines. They're examples. There could be other circumstances, and it really is just a determination that the pass-through entity should be making, just to save a lot of headaches. And if you receive a lot of pass-through funding, I do recommend at the time you are awarded it, you should be asking these questions. Is this federal funding? If so, what program does it relate to? And are there other compliance requirements we should be following? Just a general update to subpart E with cost principles. This is Sean. I'm sorry, Sean, I was stealing your thunder. I will let you have it.
That's okay. That's okay. Thanks, Dan. Actually, before we even go to this part, I did want to just re-emphasize something Dan said about the procurement standards, is that there are actually two requirements. One is that you have a procurement policy that you follow. And two is that the procurement policy that you have is in compliance with the thresholds within the uniform guidance. So you actually can have a procurement policy that's more restrictive than the uniform guidance. And if your policy is more restrictive, even if you followed the uniform guidance, but you didn't follow your own policy, that still would be considered an audit finding. So I just wanted to add that clarification. that you do need to have a policy in place that you are required to follow, and that policy has to be at least as restrictive as the uniform guidance is, but it could be more restrictive.
Thanks for clarifying that, Sean.
Yeah. So related to the cost principles, under the old guidance, so the guidance that we were operating under prior to October 1st, 2024, prior written approval was required for specific areas unless it was specifically approved in the notice of award. So these areas that are specifically listed here from the Code of Federal Regulations, if you were going to spend the grant, any of the grant money on any of these items, it was required to have prior written approval from the grantor agency, unless it was specifically written in the NOA that you could use the grant funds for these items. Under the new guidance, they made a change to where we no longer need prior written approval unless the specific cost is limited or prohibited in the notice of award. So it's less restrictive under the new guidance. It's still a good idea to make sure that the intention of the grant is related for these type of areas if it is an element of cost that you are going to use the grant funds for. But if it's not in the NOA, you generally can use the grant dollars for these areas unless it specifically prohibits that in the notice of award. So that's a little bit of good news where the uniform guidance is a little bit less restrictive than it was before. Also related to cost principles, related to indirect costs. So some organizations have negotiated an indirect cost rate for federal grants. Out of our health center clients or our hospital clients, it's pretty rare that an organization would do that, but we've got a couple that have. If you don't negotiate your own indirect cost rate, you are allowed to use the de minimis indirect rate. Under the old guidance, it was 10% of total direct costs. And they are updating that to 15% of your direct cost. Now, the rate that you would use during this transition period is going to be dependent on the date of the award. So if your grant was awarded after October 1st, 2024, you can use that 15% de minimis rate. If the grant was awarded prior to October 1, 2024, you'd still be limited to that 10%. And that's going to mean that during this period of transition, you might be using a different de minimis rate for different awards to apply those indirect costs. There was also clarification in the uniform guidance that organizations do have the right to negotiate an indirect cost rate rather than using the de minimis rate. And we do have a few clients who have negotiated an indirect cost rate, and the highest one that I've seen is 35%. Now it's on a base of salaries, not total cost, but I have seen 35% of salaries as their indirect cost rate that was approved by the federal government. So you are allowed to negotiate a rate. And then there was additional clarification that if you are a subrecipient, so if you're not the direct recipient of the award, you're getting the award from a state agency or another non-federal agency as a subrecipient, that pass-through entity, or so whoever's giving you the funds, they are required to accept whatever federally negotiated indirect cost rate that you have. So they can't override that being the pass-through entity. Related to the audit requirements in the new uniform guidance, our threshold is increasing from 750,000 to 1 million. So that's a good news for some auditees who receive federal awards. Practically most of our health center clients already have federal awards over 1 million. So this might not be as much of an impact to most of you, but there are a few smaller FQHCs that have grants that are less than 1 million, more than 750. So in those cases, no single audit would be required. It is important to keep in mind that this threshold change is not effective until fiscal years beginning on or after October 1, 2024. So generally that would mean the first fiscal year where this would apply would be the September 30, 2025, December 31, 2025, and then any fiscal year in 2026. In addition, there are some states that have their own version of a single audit act. Alaska is an example of that, and there are some others. The change in thresholds at the federal level does not automatically change the thresholds at the state level. So the state would have to go in and change their own single audit act to be that higher threshold in order for that to be effective for a state single audit, if that was the case in your state. Another threshold change is related to the determination of a major federal program. Now that determination is an auditor function. So what we do as auditors is we look at all of the federal grants that you have, and we categorize them into two types, type A and type B. Under the current guidance, type A programs are those programs that are equal or exceed 750,000. That threshold is going to change to $1 million. And then type B programs are any award that is less than those thresholds. That doesn't necessarily, or by classifying an award as a type A program doesn't necessarily mean it's a major federal program and then subject to audit. There are additional steps that we do. There's some risk assessment steps, and then there's some overall coverage steps that we do in the calculation to determine if an award is a major program. But the very first step is to categorize it between type A and type B. Type A programs are more likely to be selected as a major program than a type B, just because they are more grant dollars involved. And that second bullet talks about the modification to the type A threshold. So under the current guidance, if the total federal awards expended exceeds 25 million, then the type A threshold increases from 750,000, kind of on a prorated scale. And so you could have a type A threshold of 800 or 900,000 under the current guidance if your total federal awards are more than 25 million. That threshold is going to change to 34 million. So if the total federal awards expended is 34 million or less, that means that the type A threshold will be 1 million. If it's more than 34 million, then that 1 million type A threshold will start to increase on a pro rata basis, just like we did under the older guidance. Related to standards and scope of the audit, there was a clarification that the auditors must follow up on prior year audit findings, regardless of whether the prior audit findings were related to a major program in the current year. And essentially what that means is if, for example, the health center program was selected as a major program last year, but this entity might have quite a few different federal programs, and so a different federal program is selected in the current year. And let's say the health center had a sliding fee finding. Well, in the current year, if the health center program has not been selected as a major program, it is still the responsibility of the auditor to test the sliding fee issue to see if it's still an issue in the current year and would need to be repeated as a finding, or if it's resolved. We do see this every once in a while. We have a few clients that have lots of different federal programs in addition to the health center program. We have FQHCs that have Head Start and Ryan White programs. And so from year to year, the major programs can change. And so this is just a clarification that if there was a finding in the prior year, even if that program is not selected as a major program in the subsequent fiscal year, that finding will still need to be tested and will need to be reported as either resolved or repeated as a finding. Related to the summary schedule of prior audit findings, Dan, if you'll go back,
Sorry.
previous slide. Oh, no problem. The summary schedule of prior audit findings is the responsibility of the auditee, not the auditor. And so if the auditee prepared the summary schedule of audit findings and the auditor said, well, that materially misrepresents the status, the requirement would be that fact would have to be reported as a current year audit finding. Now, practically speaking, the auditor can still prepare that summary schedule of prior audit findings as a non-audit service. And being a non-audit service, management of the entity would have to accept responsibility for the preparation of the summary schedule of prior audit findings. And it's actually very rare in our experience that the auditee would be preparing that summary schedule of audit findings on their own. We generally help them with that, but it is considered a non-audit service that management would have to accept responsibility. And that's probably a best practice to do it that way. That way there is really zero risk that that summary schedule of prior audit findings would materially be misrepresented. So related to submission of your single audit through the Federal Audit Clearinghouse, informally that's called the data collection form. There was language added that extensions could be authorized by the federal agencies when your 9-month single audit deadline would if there was some undue burden on the auditee, if there was a reason why you would not be able to submit your single audit by that 9-month deadline, they are adding some ability for those federal agencies to authorize an extension. Under the current guidance, extensions are only offered in emergency situations. So this actually is also good news for everybody, that if there are any situations where submitting that audit within the 9 months would place an undue burden on the auditee, an extension can be requested of the federal agency. I do have an example of this related to one of our clients who shall remain nameless, where we have an audit issue where on the financial statement side of the audit, they're having some issues being compliant with their covenants on their long-term debt, and they're working with the bank who holds the debt to either get a waiver or an exception to the covenant. If they're not able to get the waiver, the entire balance of their long-term debt would have to be shown as a current liability, because it is callable under the default provisions of the loan. So, and they don't want that. That's not going to be good for anybody to show the entire debt being a current portion, as if they would have to pay the whole thing off in the next year. So they're working with the bank on getting a waiver, and that's taking some significant amount of time. Now, because of that, they are at risk of their audit not being issued by that 9-month deadline. Now, the issue has nothing to do with the grant compliance or the single audit. It's all related to the financial statement audit. So under the current rules, there really isn't a way for them to request an extension. So I think this language that they've added into uniform guidance, I think, will be helpful in situations such as that, where there's some issue out there that may or may not be related to the single audit, but it's going to cause a delay in getting that audit issued. And there is no method for issuing a single audit, like just the grant compliance and single audit section, without the financial statement audit being issued along with it, or at least first. You can issue a single audit later, but you can't issue a single audit prior to the financial statement audit being issued. The Federal Audit Clearinghouse did post contact information for the federal agencies. So if you were going to request an extension on your single audit, the link that we've included in the slides will get you to the contact information to who to request that extension from. And then we just wanted to give you a reminder on the single audit deadline. Most everyone knows that the single audits are due 9 months after the end of the fiscal year, but there is also another deadline that if the single audit is issued prior to the 9 months, which it should be, it's also due 30 days after the report is released. So if your single audit is issued 5 months after the end of the fiscal year, you have 30 days to get that single audit uploaded and affirmed by both you and your auditor. Excuse me, by the 30 days. So you have 30 days to get everything submitted with the Federal Audit Clearinghouse, even if that 30 days is well in advance of the 9-month deadline. And the next section on effective dates, we switch back over to Dan.
All right, so effective dates is where it gets a little bit tricky, as you can imagine. So the revisions are applicable to all new awards issued on or after October 1st. That's the effective date of the new uniform guidance. It gets tricky when you have awards that are already in place. Any new notice of funding opportunities should all already have the revisions of the 2024 guidance update. However, with existing awards, it comes, and you're going to hear this a lot, but when in doubt, ask your awarding agency, because there can be some confusion. If it's already an award you have, it's going to fall under the new or the old uniform guidance. New amendments on that award will also generally fall under the original award requirements, unless it's amended to state that it is under 2024 revisions. So existing awards that extend into 25 or beyond, awarding agencies may be applying them or may not be. It's going to depend on, again, is it in the award explicitly stated in the new funding opportunities or the new notice of award or anything, or is it just additional funding on a previous budget period? So again, it's really about talking to your federal agency if there's any questions on it. Agencies are encouraged to apply revisions to all amendments, but it's not a requirement yet. And I do have a chart coming up here that will help clarify, or again, you're going to hear a recurring theme is when in doubt, ask questions of your awarding agencies. As it relates to pass-through things, this is another area where it's going to be more complex, is the requirements for your sub-awards are based on the original award that is provided to the pass-through entity. So if the pass-through entity has an award under the old guidance, then the sub-recipient's award falls under that too. If the pass-through entity award is using the 2024 revisions, the sub-awards will as well. This is regardless of when the subcontract is entered into. So again, it's all based on the original award from the federal awarding agency. That being said, if you're a pass-through agency and one of your federal awards gets amended, it's very important that you pass those amendments down to sub-recipients, because that's the only way they're going to know what awards or what requirements they're supposed to be following from uniform guidance. Again, here's the chart that I was talking about. This kind of, in this situation, here's what applies. So I'm not going to go through all of these probably, but just again, if it's a new award after October 1st, automatically the 2024 revisions apply. If it's an amendment to a previous award and the amendment's issued after October 21st, the 2024 revisions apply if it explicitly states 2024 uniform guidance revisions apply. If it doesn't state that, or there's no reference, you should be assuming that the 24 revisions do not apply unless it explicitly states that. Similar things here. Again, recurring theme is when in doubt about which uniform guidance to apply, you should be talking to your pass-through entities or the federal awarding agencies to clarify anytime it's not explicit in the agreements. But this chart will kind of help you. Again, this is based on our understanding of the guidance as of now. There's another page to this here. Again, more examples of if a new award issued by a pass-through entity after October 21st, again, depends. The pass-through entity must tell sub-recipient what uniform guidance applies. The key takeaway here is when you have a question, talk to the agency, talk to your auditor. Maybe they can help you distinguish it, review the contracts. If it's not explicit, it's going to be a challenge, or could be a challenge to identify them. So this is where we're getting into some recommended best practices. We talked about policies and procedures and stuff. So we do recommend reviewing policies and procedures related to uniform guidance and making sure you're in compliance with it. Being careful not to go overboard with revisions and make you out of compliance with older grants. And maybe you have to have, you know, clauses that say that just say we're following the uniform guidance applicable to the you know, award based on date. Just again, make sure your terminology for your policies and procedures assures you're in compliance with the appropriate requirements. Be careful if your policies and procedures refer to ECFR or just the general for uniform guidance, because that could create an area where, because uniform guidance has changed, you're now out of compliance with the requirements for older grants. Again, the new uniform guidance is generally less restrictive. So if your policy and procedures reference the new uniform guidance, it may not be sufficient to ensure compliance with the old requirements. If you use ECFR, be aware that the codification on the website has already been updated as of October 1st. That's when it was updated on the ECFR too. So if you're referring to that, be careful and make sure you're referring to the right versions. If you log into ECFR, there is a way to view the historical ones in case you are trying to look up compliance requirements for old uniform guidance or new, you know, based on an old award, you need to verify the compliance requirements. You can go there and roll it back to a historical version and see what the compliance requirements were at the time for that award. Again, if you don't already have it as a policy or procedure in your internal control stuff, make sure that you're documenting reviews and approvals. Make sure you have, you know, the controls that ensure you're compliant with the grants in terms of the awards. Make sure it's being documented. Again, this is a clarification. It's not a change. It is now explicitly in there. And just be cognizant of the various levels of documentation. Does that mean your policy has to say that this specific person is going to review and approve? It doesn't say that that's what your documentation has to be. You could, you know, if you have somebody reviewing something and they're signing off that they reviewed it, that sign off is documentation of the control. It doesn't have to, it doesn't explicitly say that you have to have a policy that they review and approve. You just have to have the control and documented that it's in place. So again, maybe you don't have a formal policy of review and approval, but it's being done and you're documenting that it's being done. That may qualify as documented internal controls. We do recommend a new policy and procedure or an update to policy and procedures that as awards are being amended or you receive new awards, at the time of the award, or at the time you receive the award, you are verifying, you know, the uniform guidance applicable to the award and all these other things that could be trickier at the time of the award, not waiting till the end of year audit, because obviously if you waited that long, it kind of shows you didn't know what your compliance requirements were and what your should have been following for the year. Make sure that you're communicating to any staff or management, accounting involved in your grants and compliance processes, and make sure they are aware of the changes. And again, everything being less restrictive, generally it should be easier to be in compliance, but this transition period will be a little more difficult than it should be. I highly recommend using the SEFA as a tool more than just the financial statement. And I have an example here of it, but the SEFA that you give your auditor can be a really powerful tool. And I have an example here, and I'm going to actually bring up an Excel work paper if I can figure out how. All right, there. I think you're seeing an Excel, but this Excel actually is kind of our template that we use for SEFAs. I do recommend using SEFA as a tool to help you track this changes. This SEFA is pretty complex, or not complex, but it's got a lot of information on it. And this is what, when I go into audit at FQHC, this is, or anybody with a single audit, this is exactly everything I would want on a SEFA that I can think of. I mean, it's got the programs, assistance listing number, you know, all this stuff. And one of the things I do recommend adding to wherever you're tracking your grants is the date of the award and the applicable uniform guidance requirements. And if you verify those at the time you get the award, it's really easy. Make sure you're documenting who you got the information from, maybe if you're talking to, if it's via email through your awarding agency. But again, I always recommend to clients to, you know, use the SEFA as a tool for tracking grants, not just as the financial statements. We can take everything we need for preparing the financial statements out of this one document if it's complete. Again, as simple as adding a column to your tracking worksheet and then updating it as you get new awards. Let's see. Again, communicate, with the granting agencies when needed. If you're in doubt, do it on the front end when you receive the award. Don't put it off to the end, you know, till audit time, because if you don't do it right away, chances are you might forget about it in a week or 2 or 3. So again, be proactive. We do recommend reviewing the OMB compliance supplement. This is the tool that we as auditors refer to. Every year it gets released, generally in May timeframe. Sometimes it's been late, but every year a new compliance supplement comes out, and this is the tool that the auditors use to direct their audit testing after they do a major program determination. Once they know what the major program is, the compliance supplement tells them the requirements for the federal awards and what they need to be looking at. Some programs have certain things that we have to look at where others don't. Specific to the to FQHCs, of course, is the sliding fee testing. We have UDS testing and reporting testing. And again, do recommend that if you get a lot of grants, when that compliance supplement comes out, go take a look at it. You can know what to expect from your auditors that way. It also provides guidance on how to do the major program determination. So you could walk through your own major program determination and figure out probably what program, if you have multiple programs, what program they're going to be auditing. In part 4 of that compliance supplement, if you have a program that's listed in there, which the health center programs all are in part 4, so it will tell you specific compliance requirements related to that award. And again, this is the auditor guide. So this is what your auditor is going to come in and ask for when they perform your audit. Always communicate with your auditors. Always a best practice for any time, any of these kind of things. When you have a doubt or a question, your auditors is a good resource to either help you find the correct guidance or, you know, tell you, you know, assist you with that stuff. We can't take responsibility for what you do, but we can always lead you in the right direction, hopefully, or your auditors can. And of course, be proactive. Start now. Don't wait for the last minute. That's always going to be a hassle when we have to come in this after year end and we have to go back and try and find this historic information if it's not done at the time. All right. So some additional resources that'll help you aside from the compliance supplement that is referred to in the previous slide, which is a good resource. The Council on Federal Financial Assistance has a website. This website has an actual Excel worksheet that's a crosswalk, and it has, I think it's 3 or 4 columns, and it is here's the old guidance, here's the new guidance, here's what changed. I think there's some red line versions in there. There's a red line document of the revisions. There's some other memorandums and stuff and implementation guidance more directed for federal agencies and stuff, and kind of technical stuff. But that 2 CFR crosswalk that's on the website there, again, is here's the old versus new. The changes could be a useful tool if there's some specific changes you're looking for or want to reference. It is an Excel document, as I said, so you can search by the CFR. It's pretty easy to search, and it can be a really useful tool if you have further questions on, again, detailed changes. We also have a blog that went out, I believe, a week ago or two, in this link here below, and it's an article we have that was published that talks about how you can use your SEFA as a tool more than just a supplemental statement in your financial statements. Kind of like the worksheet I just showed you. You have to have that information in your financial statements. Generally, people track it in Excel unless you have grant tracking software. So again, just thinking about that and just using that same Excel tool to add another column and get more information, add another column, get more information. There's literally almost no end to what you could track there that you needed to, if you just are diligent about updating it and maintaining it. And that brings us kind of to the end of where we're at. We did want to leave some time for questions. I don't know if there have been any. I haven't seen any come up yet, but we do want to.
I don't see any questions in the GoToWebinar. If anybody has any, can type them really fast. We'd be happy to address any questions anybody has. As always, you're also welcome to email Dan or myself. Our contact information is on the next slide. Oh, there actually has been a question that has come up in the chat. The question is, actually, it's not a complete question. So whoever put the question in, there we go. The question is, since the COVID pandemic, there have been a number of firms that have struggled with staffing, and I think there's more coming. That comment is very valid. The CPA firm industry has struggled with staffing. Our firm has been a little bit more fortunate than most. Our staffing has been relatively stable, but there are a lot of firms, and the industry in general has been struggling with staffing. I think the pipeline has not been as robust as it has been in the past. I think the rest of the question just came back in. Says, since COVID pandemic, there's been a number of firms that struggle with staffing. Is there relief from HRSA related to auditors not being able to finish audits timely related to extensions? The answer that I would have is not that I've heard of. I always recommend to my clients that if there's any reason why a single audit is not going to be issued by the 9-month deadline, that they be proactive in communicating with the federal agency and at least letting them know. They generally are not going to give you an extension, but at least they'll know that it's going to be late. And then hopefully whatever consequences there are would be mitigated from that. I have not heard of any significant consequences, but federal agencies are able to do, whatever they do, under the guidance that they have. So unfortunately, that is the state of the industry right now, and I'm not really seeing staffing in CPA firms getting much better in the near future. There is another question. Let's see. It says, related to subpart E 200-407, the list of costs no longer requiring prior approval. Are these costs now also allowable costs to include as indirect in an indirect cost rate proposal? Dan, do you know the answer to that? I'm not sure I know the answer to that question. That's a good question.
I would say I don't know of any changes that allow that, but it's a good question. And I honestly, I don't know the answer to it off the top of my head, but I would say if it wasn't allowed before, I don't remember any changes to the cost report proposal procedures or anything related to that. So that might be one we could get, do a little more digging or see if it notes something on that crosswalk in the 2 CFR or at the CAFA website. Because cost for indirect cost, oh, never mind. I was gonna say they're based on modified total direct cost, but that's after you've done your cost proposal. So.
Yeah, that might be a question to reach out to a specific federal agency on, but I would think that if it's a generally allowable cost and not prohibited in the grant document, that you would be able to include that in an indirect cost rate proposal. But like Dan and I said, we're not 100% certain on that, so we would clarify that with you should clarify that with the federal agency. That appears to be all the questions that we have in GoToWebinar. I want to thank Community Link Consulting for putting this together and inviting Dan and I to speak to all of you. I wanted to thank Dan for putting the presentation together. He did the vast majority of all the hard work in putting this presentation together, so I wanted to thank him for that. And also want to thank all of you for joining us. We have met the 50-minute requirement for 1 hour of CPE. Community Link Consulting is awarding the CPE, so if there's any questions related to CPE credit, please do reach out to them. And with that, hope everybody has a fantastic rest of your day. Thanks.
Thank you.